Hello, everybody, and for the first of the dialogue series today, I'm talking to Dr. Winnie Mpanju Shumbusho, Board Chairperson of the RBM Partnership to End Malaria and former Assistant Director General of HIV/AIDS, TB, malaria, and neglected tropical diseases at the World Health Organization. Many thanks, Winnie, for making the time to talk to us today. I think with the recent malaria summit in London and its new commitments and research gathering apace in various areas, and the first Malaria World Congress on the horizon in Melbourne in early July, I can only imagine that you're having a fairly busy 2018. So thank you all the more for joining me today. The theme of our conversation is one of the themes of the Malaria World Congress, and it's Malaria Today, the recent history and present of malaria control and elimination efforts. So let's get started by focusing on where we stand with malaria today, if that's okay. So after 15 years or so of clear progress, last year the World Health Organization argued in its World Malaria Report that progress is stalling. So Winnie, if you could help us to kind of understand, and our listeners to understand malaria today, are we at an optimistic point or are we at a vulnerable point? How would you summarize that?
Well, thank you very much, Tim, for inviting me to this dialogue. Indeed, we are at an optimistic fight, in my view, but also at a vulnerable point. In short, we are at crossroads at this point in time. Some countries are closer to elimination than ever before, but also we are seeing worrisome increases, over 20% in malaria burden in some countries. On the positive side, though, 44 countries, the highest number ever, today have less than 10,000 cases annually of malaria, which means they can become malaria-free in the next few years. But globally, there were an estimated 5 million more malaria cases in 2016 than in 2015. And malaria deaths stood at a similar number as the previous year. So there is a bit of stalling. You could say there is a bit of complacency. And my worry is that malaria is starting to be seen as, something we've dealt with when actually we have not. At the same time, we know that the recent gains that we've seen over the last 10 years are very fragile. The experience with malaria is as soon as you take your foot off the pedal, malaria comes back in a very, a rebound fashion, which is, very, 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 more dangerous, than one can ever imagine. So we need urgent action in order to fight, to move forward, if at all we are to achieve the malaria targets for 2020, but also the goal of 2030. And I can add that, if at all we are to achieve the Sustainable Development Goals, we have to get rid of malaria, once and for all.
Right. Right. So we're at a crossroads, and if malaria itself is in the balance, then you could argue that leadership around malaria is also a real tipping point because of that, or needs to be. And at the recent London Summit on Malaria, you said that leadership, above all other factors, was a kind of a make or break factor in beating the disease. What did you mean? Why do you think leadership is so important?
Indeed, leadership for me is a make or break factor. And I mean leadership at all levels. We're not just talking about heads of states and governments. Of course, in countries and regions which have succeeded, leadership at the top and commitment has been key, has been a critical factor. But malaria fight needs to be fought at all levels. We need to, permeate all levels of society. We need businesses, communities, religious leaders, mayors, parliamentarians, and all citizens from all walks of life to see malaria elimination as part of their business and to be part of the movement and to champion efforts in their own way, in their own corner to say this can be done. and to want to end malaria in their generation. And I think this has been a key success factor in all countries that have won the battle against malaria. So we are encouraged by the recent commitments at the London Summit, where more than $4 billion were pledged towards malaria efforts. We're also encouraged by platforms such as the African Leaders Malaria Alliance, the Asia Pacific Leaders Malaria Alliance, and really we see a lot of examples where political leadership and leadership at the top has been key. But also we see heroic measures by, very humble people and communities and people in their own corners wanting to do something and saying that, if I play my part, this can be done. So these are examples, not only of multilateral efforts, but also of community efforts and movements of individuals who want, to see malaria confined to the books.
Yeah. And I think that was what you meant by demystifying leadership, that it becomes a kind of a whole of society approach. Is that the kind of thing that we're seeing in Uganda or in Senegal with kind of this whole of society approach? I know
yes. Well, sorry, go ahead.
No, I was just thinking about the Zero Malaria campaign and the measures or the plan to involve the whole society in Uganda as well. Is that the kind of thing that you mean, involving many different sectors of people?
Absolutely. Those are the examples, and we are seeing, a variety of examples of leadership from heads of states, philanthropists, community champions, and even celebrities. As we learned from the early, days of AIDS, the responses and ownership of communities. And for malaria, we have to, do more work because there are no activist groups, for malaria on the streets, parading and to claim, that this has to be ended. So we need to work very hard, knowing that malaria attacks the very vulnerable groups of society, women and children. And, poverty is a key factor in keeping malaria, the problem that it is. So we must draw on all the resources and perspectives of society. And I think parliamentarians, once you get them to understand, why this is important for their constituencies, they are very well placed to be influencers in their communities and also in their governments. So we must make sure that, this fight is inclusive and that all levels and corners of society come together to the battlefield and make sure that, malaria is unacceptable. So, we've seen, for example, mayors, specific groups such as parents, teachers, youths, employers or community health workers, from affected countries come together and join the fight. And this is the way to go because, then it becomes everybody's business, not just, the top leaders.
And while we're doing well, Winnie, you say there are 44 countries with less than 10,000 cases, less than 10,000 cases. But it's also true that 14 countries in Africa currently share something like 70% of the world's burden. So there's a real mixed bag of where we stand with malaria in individual countries. Are we being realistic when we're kind of talking about ending malaria globally by 2030, or are we adapting the approach enough and our goals according to each country's situation?
Well, you could argue that countries are different. We're seeing the highest burden in Africa, of course, and that's, the place where we really need to intensify the fight against malaria. But even in high burden countries, the picture is not always homogeneous. You may have in the same country areas which are closer to elimination and areas which are still very highly burdened. So I think there is hope, in my view, even in a country which is seen as a high burden country, because there is success which can be expanded even in that country.
Right.
And also, we see a lot of initiatives. For example, the Sahel initiative, which is coming up soon, is a good example of how you can, use leaders together with communities and policymakers, really say, in our view, in our region, this is, the way, the approach that will work for us. For example, look at Senegal and the campaign of Zero Malaria Starts With Me. That's a very encouraging example where you see leadership coming together with the private sector and with communities, and everybody bringing something on the table and to the battlefield towards, the zero malaria situation in that given country. So, and also there are examples in Asia. You see initiatives being taken by business leaders, such as the M2030 campaign that taps into consumer networks to encourage malaria awareness and action. And so 2030 may seem as an ambitious deadline, but I believe when you bring these pieces together and the possibilities, I truly believe we can do this.
Good. You mentioned the HIV response just now. One of the mantras of kind of our response to HIV was know your epidemic, and that we need to know the data, we need to know what's happening,
Yes.
where transmission's taking place. Countries like Zambia seem to be kind of, I was going to say light years, but a long way ahead of other countries. They've got very granular data on what's happening with malaria. And they're adjusting their response accordingly. Do most malaria endemic countries really understand their epidemic enough?
You mentioned Zambia, and really, it's a good example. I mean, a data-driven approach. We always say what gets measured gets done. So once you know where your hotspots are, it's easier to tailor your response, even within the same country, to be fit for purpose. So, for example, if you had been at the World Health Assembly last week, Zambia, presented this example, and it is clear that they are targeting their approach in the same country in a different, in a graduated way, depending on the epidemiology of the disease. And this becomes, very important because at some stage, you need to be able to say, let me focus more, efforts and interventions in this area because of, XYZ vis-a-vis the data that you have. Surveillance systems are critically important to make sure that we understand what we are dealing with in a given country, but also to know that there are areas where you need, to confront the hardest cases. Areas such as, hard to reach populations, migrants, people in conflict situations. If you don't have a good surveillance system that is, expanding to all segments of society, you will not know where the next epidemic is likely to come from. So indeed, we have to stress the need for evidence-based, the need for targeted interventions where you need to target, but also that, the funding should, also be put into strengthening the surveillance systems, because that's a key, in my view.
Right.
But then, while we are on that, I think what I have seen, in many countries is once the epidemiology of malaria shows that it's no longer a major killer, that it's no longer, a key cause of admissions or something that people see every day, they think that, this is done. This is the danger, I think, when we are talking about complacency, because when it comes to resource allocation, you may have to keep allocating more or less the similar level of resources to get rid of the last, the hardest cases to confront, as you do when the disease burden is still high. So this is something which we have to stress, that don't pull back just because you're seeing less kids, with malaria in the health centers, or the deaths are coming down. It may well be that, the sustainable effort you put in at that point in time is what will get you to zero.
Right.
Examples like China, for example, I mean, they had to spend a lot of, resources and sustain the efforts, even though they only had 100 cases left. But to get to zero, they had to sustain the resource investments for many years.
Right. For at least 5 years, I think, under 100.
Yes, absolutely. And to make sure that, the surveillance system was working, impeccably, so that they can spot any, new cases that come up.
The past 15 years, having a 50% reduction is a remarkable achievement. But I'm worried, or I think it's possible to worry that what we've achieved has been the easy cases, the easier epidemics, the easier communities, and so on. And do you think that's true at all? Is the hardest yet to come? Does it mean that the next 50% of malaria that we need to tackle is going to be much more challenging?
I think the closer we get to elimination, the more challenging, the fight against malaria becomes. Having said that, we still, need to ensure that the tools that we have are applied, on as wide scale as possible, because they still work. But when you reach a level where you start wondering, okay, do I need to really keep on investing this much in a disease which is less visible? I mean, take the example of polio. We are now at the last few cases of polio, and yet when there is, one case of polio, it triggers a huge response, because that's the only way to get to zero. So I think the same has to, be done with malaria, because as we are now, for example, in Africa, the interventions, even though they're effective, they're only reaching, less than 50% of the people that we reach. And that percentage is even less in the hard to reach communities. So think of what would happen if we were able to, to scale up the interventions and reach, many more people, or at least raise the percentage of people who are being reached by the interventions. I think this would take us, much, much further than we are now. So for me, I think there's a lot of missed opportunities. I think we can scale up and get to the level where we are now talking about, the few cases, the last parasite standing, or confronting the hardest, the hardest.
Right. Yeah. Do you think there are? I mean, I'm just thinking about some of the countries where we're seeing quite stubborn epidemics, or it's been more difficult. I mean, are there hard to reach countries, maybe because of instability or post-conflict and so on? Is there special cases that we need to kind of address more actively?
I think whenever you have hard to reach populations, or people in conflicts, or people who are marginalized for any reasons, the intervention reach is often very poor. And this can be quite unpredictable, because even in a country which is making good progress, towards eliminating malaria, all you need is one conflict scenario, and then, malaria could come back with vengeance. Right. Or if you have a human, catastrophe, or you have floods. So there is always need to be vigilant and make sure that, no one is left behind, because if everyone is being reached, if there's no discrimination in terms of who accesses the the malaria interventions, then you can, you'll have more preparedness even when there is a situation of catastrophe.
Mm-hmm. I know one case that's been talked about a lot over the last couple of weeks is Venezuela and the economic catastrophe, and alongside that, half a step behind it, we're seeing a kind of resurgence in malaria there as well.
Mm-hmm. Mm-hmm.
Yeah. You mentioned that leadership needs to come from many different quarters. The forthcoming Melbourne conference is really trying to be the first global event to try and bring together the different sectors that need to work together to end malaria. This has arguably not been a strength of the malaria community, as you kind of alluded to at the beginning. Will it be difficult for, whether it's Melbourne or just generally malaria, to bring together these different sectors, different factions, different people with various priorities to work together? I mean, do you feel that you're optimistic about that?
I am optimistic about it because I think that because malaria has been seen as something that is acceptable. People don't think too much about the fact that malaria is killing so many people as we speak now. People get excited when there's an emergency, and they focus on Ebola or something that may erupt tomorrow or the day after. But really, there's a disease which is killing people every day. And therefore, I think if we are smart and successful, we should be able to bring in, all sectors that can play a part in this.
Right.
I see examples where, for example, tourism is seen as a sector which has high stakes in malaria. Right. Agriculture and irrigation, forestry, but also we need to bring on board the non-traditional players like finance ministers and development sectors who are not in a day-to-day business of thinking about malaria. So platforms like the Melbourne conference, can do a lot to raise that awareness, and even to invite people who are not traditionally, having to deal with malaria on a daily basis, and kind of spearheading a movement which will transcend the conference itself, but get into people's mindsets, but also bring together people at country level to have a dialogue as to what else they can do and how they can optimize the resources available to fight this disease. Because I believe that when the sectors come together, it soon becomes clear that no one will succeed, and the sustainable development goals will not be achieved if everyone doesn't play their part. And therefore, the other sectors see what is in there for them, in this disease. And then it becomes something that they regard as their business, even though they may not be, working in the health sector.
Right, and I think that's the key to the RBM partnership to end malaria. And I'm sure, are there specific ways that the partnership is trying to bring together people in these ways? Absolutely.
This is the DNA of the RBM partnership, and so we are working very hard to bring the various sectors together, from infrastructure to tourism to forestry to agriculture, and to make sure that the key influencers in society who can also influence those sectors, such as parliamentarians, we're bringing them together to have a dialogue on the need to really work together in a multi-sectoral way to end this disease, but also saying to them, if you can succeed in the battle against malaria, you will have succeeded in building a system that is resilient to other things. So we're encouraging them, use this as a litmus test for your efforts in the, towards achieving the sustainable development goals.
Right.
So I think that, if there is anybody out there, any sector or any grouping who is not part of the partnership, they should join the partnership, because I think together, we achieve economies of scale, but also it's easier when the sectors work together rather than working in silos.
Mm-hmm, mm-hmm. That's a very clear invitation. That's good. So you all heard that. If you're not taking part in this so far, please do reach out to the partnership. We should say something about the financing question and where the money's coming from, because it's a very important question, and we've talked about co-financing quite a lot, where countries and international money are kind of blended, domestic funds are blended together, especially as countries kind of graduate from external funding schemes like the Global Fund, for example. But do we have time? Do countries have the time to kind of transition into those new forms of financing? Won't that need structural changes, like changes in taxation or levies to raise more money? Are we giving them enough time?
Currently we have, I think it's too little money being spent on malaria. We only have about 2.7 billion being spent on malaria, which
globally.
Is less than the World Health Organization estimates of the funding that resources that are required annually. If you break it down, and malaria endemic countries contribute about 1/3 of the total of their malaria funding. So, but I think we can do more. We can do better than that, because we see that although African leaders committed to allocating 15% of their national budgets to health back in 2000, only a couple of countries have achieved, that target to date. So I think there's room for more. And also what we are saying, as a partnership, is to say this has to be a battle that is owned by countries. Therefore, the issue of domestic financing is a serious issue, because there is no way we can sustain the gains, even in countries which have succeeded to reach, towards the last mile, if there are no domestic resources being put into fighting this disease and keeping it, away. So domestic financing is key, but we also can do more in terms of looking at, okay, what else is out there? At community level, there's so many ways of engaging, communities in a resource mobilization fashion that makes sure that, they see sustainability as something that, they can, they're responsible for. So I think it has to be a combined effort. So you need external funding, you need, domestic financing to be stepped up, but you also need to find other innovative ways of financing the malaria response if it is to be sustainable. Yeah. Right.
And I guess so that's kind of
in terms of, the new mechanisms, like, for example, tax levies, debt swaps, and investment cases, because this is what, helps to bring more resources on the table. And because of that, the RBM Partnership is working to, hard to establish this malaria financing task force, which was established last year, to see how that can be a catalyst in terms of, resource mobilization for malaria. Yeah.
Right. So it's kind of getting around the other side of the financing argument and saying this is not money we need to spend, but this is potentially money that we can save in the longer term.
Absolutely. Yeah.
Right. It's going to be, let's see. I mean, there were some great gains and commitments made at the London summit in vis-a-vis resources, and some of those were very innovative approaches. So let's hope it comes in. Let's hope that we realise that those resources. To finish, really, I'd like to kind of go back to the partnership, because it's later this year the RBM Partnership to End Malaria is 20 years old. And you're the chair of its board. So I'd just kind of like to ask generally, how does the partnership add to this mix of actors you've said about some of the working groups and so on? And if you could just say a little bit about the kind of transition that the partnership is going through and what your goals are going forward.
Right. So it's indeed, the partnership is 20 years since it's 20 years old since its establishment. So this year we are celebrating the 20th anniversary of the RBM Partnership. It is, of course, the largest global multi-stakeholder platform, as you said, on malaria, with more than 500 partners in all parts of the world. And we keep on saying, if you are out there and you haven't joined the partnership, please do. There are ways to do that. The website has, very user-friendly tools to help you do that. So as you know, Tim, this was formerly known as the Rollback Malaria Partnership in those days when it was established. But it has recently changed its name to RBM Partnership to End Malaria. To reflect the opportunity the world has to end malaria and also our ambition to make that happen. Right. So we remain by, our philosophy that working together, we can achieve more. And so the partnership brings people together to do things. And thanks to the efforts of the global malaria community all over the world, over the past 2 decades, we have saved nearly 7 million lives. And I'm saying we can do more. And, we can seize the opportunity and say, we are the generation that, will end malaria. And I believe we can. Right. But also, we should ask ourselves the question, if we don't end malaria, who will do it? And if not now, when? So I think that, our generation, has the responsibility to make sure that we confine this entirely preventable, entirely treatable, and easily diagnosable disease, to the history books.
Right. Well, that's a great optimistic note to end on. I will try to make sure that I get the name of the RBM Partnership to End Malaria correct every time now. Let me be one of the first to wish the partnership a happy birthday for later this year. So in closing, I'd just like to sincerely thank you again, Dr. Winnie, and for sharing your thoughts and ideas so freely with us today. And we look forward to hearing more from you at the Malaria Congress in July. And thank you very much. Thank you.
Thank you very much, Tim. And I think we are together in this fight. And thank you for what you do to contribute to the fight against malaria. Thank you very much.
Thank you. Thank you very much.